Hello, my name is James Radke, Managing Editor at CheckRare, and I recently had the privilege of talking with Guillaume Canaud, a pioneer in research involved in PIK3CA overgrowth related syndrome. Basically, he and his team have changed the treatment landscape for this disease with finding systemic treatment that can allow these children and adults to lead relatively normal lives. It was a pleasure talking with him. Enjoy our conversation.
My name is Guillaume Canaud. I'm a physician and a scientist. I'm working in Paris at Necker Hospital. And I'm taking care of patients with PIK3CA-alpha gain-of-function mutation. It's a rare disorder that affects probably one patient over 20,000 in the general population. And that kind of disorders are leading to overgrowth syndrome, so different type of malformation that affects only some part of the body and some tissue layers. So that kind of disorders are due to genetic mutation that are occurring during the embryonic development. We are talking about gain-of-function mutation that lead to cell growth and cell proliferation. So according to the moment where this mutation will occur, you may have some different part of your body that can be affected and some tissue layers that can be affected differently. Some patients are presenting with just an isolated lesion like a macrodactyly, or sometimes it's more complex. The brain is involved. So we are talking about hemihyperplasia or complete megalencephaly. And sometimes this is the entire body that is affected, and we talk about CLOVES syndrome. So I would say that more than 80% of the body is affected. We don't really understand everything right now. That kind of mutation is really occurring during the embryonic development, meaning that the parents are not carrying the mutation. It's not inherited, and this is not transmissible. It's only affecting a small part of the body or a major part of the body, but again, it's not transmissible. We don't know why you have that kind of mutation that occurred during the embryonic development. Probably this gene is highly susceptible to some spontaneous mutation because, in fact, this gene is frequently affected in cancer. It's a mutation that we can detect in breast cancer, in colon cancer, in thyroid cancer. So it's a gene that has some susceptibility, some degree of susceptibility for spontaneous mutation, I would say. But why these mutations are occurring along this gene, we don't know. In 2018, we published a paper with my group where we created a mouse model that recapitulates this PIK3CA-Related Overgrowth syndrome. And we identified a drug that was called at that time BYL719, and that is now called alpelisib, as a very promising candidate. I mean, in the mouse model, it was able to reverse the disease and to greatly improve the mice. And based on this data, we were allowed to treat a cohort of 19 patients in France using a specific compassionate use program with alpelisib. And we treated pediatric and adult patients, and these 19 patients were improved by the treatment with, I would say, a low rate of adverse events. So this was not a clinical trial, but this was a cohort of 19 patients having a compassionate use program. It's not a randomized control trial as we usually see. Once we published this paper, it was in June 2018, this was published in Nature, we were bombarded of emails from patients from all over the world. Really, I had no idea that this paper would have such impact for this community, and I had no idea about the number of patients that were living with that kind of condition. Just to give you an idea, we received more than 4,000 emails in a month. So now we have seen plenty of patients. So we had to reorganize our structure here at Necker. So we are seeing patients from all over the world, including patients from US, the United States. And we are seeing between 6 and 12 patients per day, and approximately 1/3 of them are new patients. So just to give you an idea about the number of patients that exist with that kind of condition. Since we had all these patients, we went to see Novartis, the owner of the drug, alpelisib, to see how we could move forward and see how we could prepare maybe a clinical trial or something else. Novartis went to see the FDA in 2019, and they proposed to do a retrospective chart review of the first 57 patients ever treated in the world with this drug and having a PROS, PIK3CA-Related Overgrowth syndrome. And the FDA agreed with that, saying that they would be interested to have that kind of data and maybe to consider a future application. So we have designed with Novartis this retrospective chart review. At CheckRare, we had treated initially 19 patients, but of course we had more and more patients, and we were allowed to treat only patients that were in very poor condition. So at that time, we had 44 patients at our seats, but other physicians started also to use this drug in other countries, in the US, in Australia, in Ireland, elsewhere. And we contacted all these centers, and we collected the clinical information, radiological information, biological information. Everything was collected by Novartis and examined independently by a CRO, an independent CRO in the US, to check the improvement or not of the different symptoms that these patients are complaining about: fatigue, pain, overgrowth asymmetry, I would say, disseminated intravascular coagulation, and so on. And also to check the MRI of this patient before and following drug introduction. In fact, when we started the drug here in our patient, in order to have hard measure, hard objective, things to really measure and to follow over time, we had photography, we had biological things, but we wanted to have some hard endpoints in our compassionate use program. So we did MRI prior to drug introduction and 6 months later. And most of the groups elsewhere did the same thing. So Novartis collected these different imaging and reanalyzed the MRI from all the patients independently. And they found that 37.5% of these patients had at least 20% reduction in the volume of one or several malformation, and 74.7%, if I'm correct, of these patients had an improvement on another malformation in terms of volume. And all the patients had symptoms improvement. So all these data finally were demonstrating the same thing as we observed in our initial cohort of 19 patients. These data were submitted to the FDA that considered them positively. Then we had an FDA inspection on site at CheckRare at the beginning of February. We had the FDA inspectors for 2 weeks. They have checked everything: medical records, imaging, biology. They went to the pharmacy. They checked everything. And then 1 week after their inspection, we received a letter saying that our data were cleaned, objective, reliable, and true. And so this led to the FDA approval. So this is an accelerated procedure. This means that we need to confirm with additional data in the next few years. And other agencies like the EMA or other agencies elsewhere are considering this data, but they need to have a randomized control trial. So we have designed in parallel what we call the EPIC-P2 clinical trial, where you have a group that is treated with placebo and another one that is treated with alpelisib. And the primary endpoint for this population is a reduction of at least 20% of the mass at 6 months following drug introduction. So this is more a classical way to do a clinical trial, but that was challenging because, again, even if we are seeing plenty of patients, this is still a rare disease. And so all these patients, again, do not have the same clinical presentation. So it's hard to consider them all in the same way for a clinical trial. Of course, and the megalencephaly or a macrodactyly will not respond to the same extent to a patient with a vascular malformation. So that's how we were able to obtain this FDA approval. It was challenging, of course, but super exciting. And I would say that we were super proud because again, when we think about the last few years, I mean, we published that in 2018, and 4 years later, this was approved in the US for adult, but also the pediatric population. So that's a very nice accomplishment for us and for Novartis also.
It's